Today, I'll be sharing my multimodal project, which focuses on one of the most urgent and widespread issues in the healthcare field: burnout among healthcare workers. I chose this topic because throughout the semester, my research revealed just how deeply this problem affects not only healthcare professionals, but also patient safety, organizational stability, and the future of our entire healthcare system. Burnout is not just personal stress, it is a systemic problem that demands systemic solutions. Healthcare workers are reporting record levels of exhaustion, emotional fatigue, and mental health strain. The National Academy of Medicine reports that more than half of the healthcare workers experience significant burnout symptoms, and the World Health Organization now considers burnout an occupational workplace issue caused by chronic stress. As someone preparing for a long term career in healthcare, I found it alarming that the people responsible for caring for the public often cannot access the care and support they need themselves. This inspired me to take a deeper look at why burnout happens and what we can realistically do to change it. For this project, I chose healthcare workers themselves as the intended audience. These are the people most affected by burnout, and many feel overlooked or unheard in discussions about workplace well-being. I designed my sway to feel like a professional, modern healthcare website, something workers can engage with quickly, visually, and meaningfully. My goal was to create a source that healthcare workers could easily understand and use while also empowering them to advocate for the changes they deserve. These are the perspectives on the problem. One of the major challenges I highlight in Sway is how burnout affects different groups in different ways. Healthcare workers deal with mental fatigue, anxiety, sleep patterns, and emotional strain. Many describe feeling like they work on autopilot because they don't have time to recover. Patients are affected through increased risk of medical errors and longer wait times when staff are overwhelmed. Hospitals and organizations experience turnover, lower job satisfaction, and financial losses when burnout drives workers away from the field. I chose these perspectives because they show that burnout is not just a worker problem, it's a system wide threat that affects everyone connected to healthcare. In my sway, I used images of real clinical settings, burnout statistics, and short quote cards to make these perspectives more relatable and impactful. These elements help the audience feel the weight of the issue without overwhelming them with text. My sway also briefly touches on previous attempts to address burnout, such as wellness workshops, mindfulness sessions, and employee assistance programs. While these can help individuals cope, research shows they don't fix the structural causes of burnout, things like staffing ratios, workload, or administrative burden. This background sets the stage for why a new solution is needed and why the current quick fixes are not enough. The core of my sway presentation focuses on a system level proposal with multiple components working together. These include improving staff ratios to reduce overload and increase safety, providing on site mental health support that is confidential and stigma free, training leaders to create supportive, psychologically safe environments, reducing administrative burden through better workflows and technology, and tracking burnout metrics to measure real progress over time. I highlighted these steps in this way using icons, bullet points, and simple headers so the plan is easy to follow. For healthcare workers, clarity and practicality are essential. They need solutions that can actually fit into the realities of their everyday work lives. One of the requirements of the project was to explain that the solution is realistic. In the feasibility section, I explained how these changes can be funded, including federal grants, hospital reinvestment, insurance incentives, and savings gained from reduced turnover. I also included graphics to show how implementation can begin with pilot units and scale up. Addressing potential barriers like leadership resistance or concerns about cost was also important. So I included explanations showing how the long term financial and safety benefits outweigh the upfront investment. I chose to end my sway with a call to action directed to healthcare workers themselves. Even if workers can't change policy immediately, they can still participate in burnout surveys, join committees, speak up about unsafe staffing, and share resources with leadership. My message is simple: healthcare workers cannot keep caring for others if no one is caring for them. System level support is not optional, it's essential. Through the semester, I learned that burnout is not just a workplace inconvenience, it's a crisis affecting the entire structure of healthcare. Working on the same issues across multiple assignments helped me understand how deep and complex the problem truly is, and it also allowed me to create a meaningful research based proposal. This project gave me the chance to communicate that message creatively and accessibly, and it and I hope it speaks directly to the people who need and deserve change the most. Thank you.